Hi, my name's Dr Joe Kosterich. I've been a GP in Australia for over 30 years and I'm also a medical advisor to Little Green Pharma. This instructional video today is for patients and carers of patients who've been prescribed any of the products from the LGP Classic range. We're going to show you how to administer the medication that you've been prescribed. Now, necessarily for demonstration purposes, the oil that you're going to see is olive oil. Now, inside your box, and this is obviously one without a label, you'll find a number of things. Firstly is the consumer medical or product information, and it's recommended and really important that you read this before taking the product. In fact, that applies to any prescription medication. You'll also find a syringe, and this may be green, red or blue in colour. There's a blue stopper to go at the end of your syringe, a clear plastic adapter that will go into your bottle, and we'll show you how to do that later, and of course a sealed 50 ml bottle of oil. So step one is to open your bottle, and like a lot of medicines, it's a child-proof lock, so you need to press down and twist at the same time to open up your bottle. Now, second step is to put your clear plastic adapter into the top of the bottle. So you just insert it like that and press down. You might want to use the palm of your hand, that will work. Now, for some people, if you find that you haven't quite got the strength in your hands and you're worried about this, then you can ask your pharmacist to do it for you. Now, if that's not possible, some patients have told me that they find it helpful to take a small drop of oil and lubricate the inside of the jar to help them slide the adapter in. Right, so the next step will be to insert your syringe into the bottle. Now, if your cap is on the syringe, take that off first. If it isn't, then you don't have to do that. Put the end of the syringe firmly into your adapter, and then turn the bottle upside down. You can then pull the plunger of the syringe slowly out so that you draw out the amount of oil that is your correct dose. Now, with the olive oil here, for demonstration purposes, I'm going to pull out 1 ml, as you can see. Now, next step is tip your bottle right way up again, and then you can remove the syringe. It's best to administer the oil under the tongue. I'm going to squirt this in now. Remember, we're using olive oil. Now, some patients say they find it helpful to hold the oil under their tongue for up to 15 seconds before swallowing, and they say that that helps them with onset of action. This is something you need to see what works for you. So after you've administered your medication, put your cap back on the bottle. Obviously, we've left the adapter in place, that stays put. Rinse your syringe in warm soapy water and then rinse with warm water and allow to dry. Once dry, put your syringe cap back at the end of your syringe. You can then keep your whole unit clean for next time.